Tamiflu Suspension, Reconstituted is a medication used to treat symptoms caused by the flu virus, such as a stuffy nose, cough, sore throat, fever/chills, aches, and tiredness. It can make these symptoms less severe and shorten the recovery time by 1 to 2 days. This medication can also be used to prevent the flu if you have been exposed to someone who already has the flu or if there is a flu outbreak in the community. It works by stopping the flu virus from growing. It's important to note that Tamiflu Suspension, Reconstituted is not a substitute for the flu vaccine. Always consult with your doctor for more details on the best time to take this medication and the appropriate dosage for you. Before taking Tamiflu Suspension, Reconstituted, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food, and you may take it with food or milk to minimize stomach upset. It works best if you start taking it within 2 days of flu symptoms appearing or after being exposed to the flu. Shake the bottle well before each dose and use the oral dosing dispenser provided by your pharmacist. Measure each dose carefully and give it directly into the mouth. Do not mix with other liquids. After each use, rinse the dispenser with tap water and let it air dry. If you lose or damage the dosing dispenser, consult your pharmacist for a replacement. If you have the flu, take Tamiflu as directed by your doctor, usually twice a day for 5 days. To prevent the flu, take it as directed by your doctor, usually once a day for at least 10 days. The dosage is based on your medical condition, kidney function, and response to treatment. Take this medication at the same time every day, and continue to take it for the full time prescribed, even if symptoms disappear after a few days. If your condition lasts or gets worse, or if new symptoms appear, be sure to inform your doctor. If you experience nausea or vomiting while taking Tamiflu Suspension, Reconstituted, be sure to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor believes that the benefit to you outweighs the risk of side effects. Many people who use this medication do not experience serious side effects. However, it is important to be aware that the flu itself or oseltamivir may rarely cause serious mental or mood changes, particularly in children. If you notice any signs of unusual behavior such as confusion, agitation, or self-injury, be sure to contact your doctor right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. It's important to speak to your doctor or pharmacist before taking Tamiflu Suspension, Reconstituted if you have any allergies or medical conditions, especially kidney disease. The liquid form of this medication contains sorbitol, which may cause stomach upset and diarrhea in people with certain sugar intolerances. If you can't tolerate sorbitol, your doctor may prescribe the capsule form instead. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and supplements you're taking. If you're pregnant, only use this medication if it's absolutely necessary, and discuss the potential risks and benefits with your doctor. While this medication can pass into breast milk, it's unlikely to harm a nursing infant, but it's best to consult with your doctor before breastfeeding. As always, your healthcare provider is the best source of information for any concerns you may have. It's important to be aware of potential drug interactions when taking Tamiflu Suspension, Reconstituted. It's possible that other medications you're taking could affect how Tamiflu works, or even increase your risk of experiencing serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as any herbal products, and share this with your doctor and pharmacist. Additionally, it's important to let your doctor know if you have received a flu vaccine in the nose within 2 weeks before starting treatment with Tamiflu. This is because the medication may lower your protection from the flu vaccine given in the nose. After finishing your treatment with Tamiflu, it's advised to wait at least 2 days before receiving the flu vaccine given in the nose. This way, you can ensure that you are fully protected and that the medication doesn't interfere with the effectiveness of the vaccine. If someone has taken too much Tamiflu Suspension and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can call 1-800-222-1222 for their local poison control center, while Canada residents can contact a provincial poison control center. Remember, it is important not to share this medication with others. Also, it's worth noting that Tamiflu Suspension, Reconstituted is not a replacement for the flu vaccine. It's always a good idea to consult with your doctor about the risks and benefits of getting a yearly flu shot to help lower your chances of getting the flu. If you forget to take a dose of Tamiflu Suspension, Reconstituted, take it as soon as you remember. If it's within 2 hours of your next scheduled dose, then skip the missed dose and just take your next dose at the regular time. Do not take a double dose to make up for the missed one. After the pharmacy mixes the Tamiflu Suspension, Reconstituted, you should refrigerate it and use it within 17 days. Do not freeze it. If you store it at room temperature, it will expire sooner, and you should throw away any unused portion after 10 days. It's important to check the bottle or ask your pharmacist for specific storage instructions. Keep all medications away from children and pets. When you no longer need the medication or it expires, be sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for the correct way to dispose of it. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.